If you've recently had a DEXA scan and you're scratching your head about those T-scores and Z-scores, then you're in the right place. In this video, we're going to break down what they mean, why they matter, and some of the limitations as well. My name's Dr. Tom Forfa, and I'm a retired medical doctor. I was diagnosed with early onset osteoporosis almost 4 years ago, and I reversed it naturally, drug-free, using my knowledge and medical skills to research and understand what has to be done to strengthen bone. Now I'm on a mission to help other men do the same. So let's start with what is a DEXA scan. It's a simple and painless test like an X-ray that measures the density of your bones. It helps your doctor assess your bone strength and health. When you get your scores, you'll get two scores, T-scores and Z-scores, or Z-scores for our American friends. And the main one being the T-score. You'll usually get a score for your lower back and your hip. And in some cases, you'll also get the end of your forearm tested. So let's start with the T-score. What's it all about? Well, think of the T-score as a comparison of your bone density to that of a healthy young man. Now, let's stop for a second there. I think I'm a healthy young man. And we all probably do think we're young men, or some of us do. But what they're referring to here is a man of about 25, at about 25 years of age with healthy normal bones. And so when they're talking about a T-score, it's like getting graded on how your bones measure up to peak bone density, because at 25 is where we kind of hit our peak bone density. So it kind of looks like this. So if your T-score is about -1, then your bone density is considered normal bone density. If your T-score is around 0, it means your bone density is average for a healthy young male of about 25-ish. And if your bone density is between -1 and 2.5 in this range here, then you might have a bit weaker bones than average. So you're below average, and that's often referred to as osteopenia. And if your T-score is -2.5 or lower, it means that your bones are weaker and you might have osteoporosis, which is a condition where bones can break more easily. Now, before we talk about osteoporosis, let's address the difference between T-scores and Z-scores. So T-scores compare your bone density to that of a healthy young male, as we mentioned earlier. Z-scores compare your bone density to men of your own age and ethnicity. So Z-scores can give you a better idea of how your bones stack up against your peers, which can be useful to know in certain circumstances. So this is what it looks like when you get your DEXA scan results. You'll have on the left here, you'll have an image of the area that was tested. You might have this colorful display of where you fit. And if we look down the right-hand side, you'll see those T-scores that we mentioned earlier. And then you'll have this area down here where you will have, for example, the region, the vertebrae here that's being assessed. You'll have the bone mineral density, so how many grams of bone per square centimeter, and you've got it laid out there. And then you've got the T-score comparing you to a young adult, and then the Z-score comparing you to someone of the same age. And then you've got the T-scores down there, and you've got the Z-scores down there. Now let's connect the dots between these scores and osteoporosis. So here's the key to remember. Osteoporosis is typically diagnosed not just on the numbers, but through a combination of a clinical assessment and the DEXA scan results. And so when it comes to the T-scores, a score of -2.5 or lower is generally indicative of osteoporosis. This means, like we said, your bone density is significantly lower than that of a healthy young male, putting you at a higher risk of risk fracture and other bone-related issues, which we'll talk about in a second. Now, you should talk to your doctor about this if you fit into this range. And an important question to ask at this point, and a lot of people ask me, is what is the difference between T-score, or a T-score of say -4 and a T-score of -2? So imagine you have a line that shows you how many people are at each T-score. If this is that line right here, and underneath it are all the people, is a distribution of all the men and their T-scores. And in the middle here, we have 0, we have 1, we can have positive T-scores, so there's stronger bones there. And then we have -1, -2, and -3. The middle here is where most men sit, right? Right there. That's why the line is the highest in the middle, because there's the most amount of people there. Between a -1 and a +1. Right? This right here is the normal range, and most men fit into that area. Now, if your T-score is below -1 or below, that's called osteopenia. If we go down here to a -2.5, then that is osteoporosis below that. So if we color these in, over here we've got osteopenia, and right here we've got osteoporosis. And as we go down this line, our bone density reduces, but also the number of men who have that T-score reduces as well, so the line goes down. This is what the numbers mean. But what's important to understand is how this affects your risk of breaking a bone, because the scores alone don't do it justice. So if we were to draw a line that represents your relative risk of a fracture, it would look like this. It starts off very high up here, and then starts to fall very quickly, and then starts to peter off, and then slowly approach the bottom line here. So if you've got a -4, your T-score is going to be out here somewhere, right? -4, if that line were to extend. So that means that your risk of a fracture will be quite high all the way up here. Now, I'm not saying this to frighten anyone, but just to explain the significance of what's going on and that you need to do something about it. Okay, so then when you move from it, that score of -4, your risk is up here somewhere, right? It's up here. So if we kind of do a line across to there, and then if we move to a 2, your score is about here. And that right there represents the drop in your relative risk when you go from a -4 over here to a -2 over here. All right? Now, whereas when you go from a -2, which would be kind of along here, to a 0, the drop in relative risk of a fracture is much smaller. Now, I'm not saying this to belittle the improvement with T-scores at this level. In fact, men at this stage still need to strengthen their bones to give yourself as much buffer as possible in case things start to deteriorate. So you have a longer runway before things get potentially dangerous. So just to bring all that together, a move of a score from a -4 to a -2 is the same in terms of 2 points when you compare it from a -2 to a 0. However, the change in your risk of fracture is very big. So for the men who have lower T-scores, it's very important that you make changes and make improvements and actively address your bone strength. And at the same time, it's important for men like myself and many others whose scores are between that -2 and 0 to continue to improve so that you get that buffer and you're ahead of the game. So this is how T and Z scores work. But while they're useful, T-scores have some limitations. So here's what you need to know. Firstly, fracture risk, as we've just mentioned. T-scores alone don't give the full picture of your risk of fractures. There are other important factors like family history, previous fractures, your risk of falling, and other health conditions. All these things play a big role in determining how likely you are to break bone. Next up, you've got bone quality versus bone density. T-scores measure how dense your bones are, but they don't tell you about bone quality. Bone quality is also really important for bone strength and fracture risk. Then we've got the microarchitecture. This refers to the tiny structure within your bones. T-scores don't measure this. So someone might have normal bone density, but poor bone quality, which increases their fracture risk. And this can happen with some of the medications. Site-specific measurements is another limitation. So T-scores are usually taken from specific spots. Like we said, the hip, the spine, and the forearm. But bone density can vary in different parts of the body. And a T-score from one spot might not show the whole picture of your bone health. Then we've got localized conditions. Conditions like arthritis can affect bone density readings in certain areas, making T-scores less accurate. And then we've got changes over time. A T-score gives you a snapshot of your bone density at one point in time. It doesn't show changes over time, which is important for seeing how the condition is progressing and if treatments are working. That's why regular checkups and multiple scans over time are needed to see trends in bone density. Then there's the technological and measurement variability. What this means is that different DEXA scan machines will give you different T-scores, and different settings on that machine can also give different T-scores. So it's important to use the same equipment and settings to get accurate comparisons. And finally, there's the operator skill. The person doing the scan needs to be skilled and experienced. If the technique isn't consistent, the T-score might not be reliable. So what this means is that while T-scores are a valuable tool for diagnosing and managing osteoporosis, they shouldn't be the only tool used. It's important to consider other factors and assessments to get a full picture of bone health. But now you understand what you're looking at in the results of a DEXA scan, and will hopefully see progress over time as well. So thanks for watching. If you found this video helpful, please hit subscribe to the channel so that we can help more men with osteoporosis. And if you have any questions, please leave them in the comments below, and let's get men's osteoporosis out of the shadows.